Hello, I'm going to go over how to administer an IV piggyback medication. When you receive your order, you need to make sure that it is a valid and accurate, complete order. Otherwise, make sure that you clarify it with the provider. You'll also want to assess for any patient allergies the patient has. If there are any relevant lab values needing assessed, you'll need to do that. You'll also want to make sure the current IV fluid or any medications that are being infused through the IV are compatible with the new medication. Once you've completed those assessments and you've been following your medication rights, then you can go ahead and take your medication, IV piggyback, along with your IV tubing and a alcohol swab, and then your label for your tubing with you to the patient room. Once you're in the patient room, you'll perform your hand hygiene. Then you're going to inform the patient of what medication they're going to be receiving, what it is for, any potential side effects they may have from it, answer any questions that they have about the medication, and then you'll be able to go ahead and hang the medication for infusion. We've got our hand hygiene already performed. I've also raised the bed up to a good working height for me, and so we'll go ahead and get started in getting the medication given. Before I actually hang the medication, I'm going to check the IV site. Since it's got a continuous IV infusion, I'll just check to make sure there is no redness, there's no edema, any pain at the site. The site is warm and dry to the touch, and this IV is, so it's going to be okay to go ahead and start the IV piggyback medication. Your IV piggyback bag has a port cover that you're going to need to pull off. Then you'll also need to open your secondary tubing. Your secondary tubing will have a hook in it to allow you to lower the primary line fluids. So we'll go ahead and do that. Then we'll take our tubing and we'll open that, straighten it out, being careful not to touch the floor with any of the tubing. The two ends of your secondary line need to be kept sterile. So whenever you remove the protective caps for each of those, this is a protective cap, and then this is a protective cap. Once you remove that, then the ends have to remain sterile. So we'll go ahead and take our roller clamp and slide it all the way up underneath the drip chamber. And this here is your drip chamber. On your roller clamp, you want to roll it all the way down, and that'll keep the fluids from flowing once you spike the IV bag. You can spike the IV bag one of two ways. You can either hang it up here and then spike the IV bag, or you can hold it in your hand and spike it. I prefer to spike it holding it in my hand because it gives me more control. So you'll need to remove the cap, and you'll need to remove this cap here. Being careful not to touch anything else, you're going to insert the spike into that port, and you may have to twist to get it in there securely. Then you're going to hang your IV bag. Now you want to make sure your drip chamber is 1/3 to 1/2 full of your IV fluid, so you'll squeeze the chamber. If you should accidentally get too much fluid in here, you can invert and then squeeze the chamber to squeeze all of the fluid back into the bag. Now that we have the drip chamber about half full, we'll go ahead and slowly release this roller clamp to allow the fluid to go through the tubing to get all the air out, and this is referred to as priming the tubing. You can let the fluid drip into a sink or into the trash, whichever one works. Just make sure to check your IV tubing again to make sure that there isn't any air in the line. Now you're ready to go ahead and connect the secondary tubing to the primary line. You'll want to connect the secondary tubing to the highest port on the primary line. So for instance, with this IV tubing, this is the highest port, and so that's the one that we're going to connect it to. You'll want to take an alcohol swab and clean the port for 15 to 30 seconds. Then you're going to take your secondary tubing, take the end cap off, and then you're going to push it into the center and twist. Now you're ready to infuse your IV Piggyback medication. You'll go ahead and release the roller clamp, and if you are going to be administering the medication by gravity, you will use the roller clamp on the primary line to regulate the drip rate on your IV Piggyback. Just remember, whichever of your IV fluids are higher, that is the one that's going to infuse first. So make sure that you always have your IV Piggyback at the highest level if that's what you're wanting to infuse. If you're going to be using an electronic infusion device like an IV pump, then you would go ahead and connect the IV to that pump and then program the IV pump for the rate you would like the IV to run. The last thing that you'll want to do is to go ahead and take your label, and you're going to label that IV tubing so everyone will know whenever it needs to be replaced. After that, then you're going to go through your patient safety measures. You're going to want to make sure the patient has all of their belongings close to them with their hospital table. They have their call light. They have all of their needs met and don't have any other questions. Make sure the bed is in its lowest and locked position. And then before leaving the room, you're going to perform hand hygiene. And that's it. Thanks.